Do nasal strips help with sleep apnea? If you're one of the millions of people struggling with sleep apnea, you might be looking for any solution to get a good night's sleep. One question that often comes up is whether nasal strips can help. Let's break it down. Nasal strips are small, adhesive bands that you stick on the bridge of your nose. They work by gently lifting and widening your nasal passages, which can improve airflow and make breathing easier. This can be especially helpful if you have nasal congestion due to allergies, colds, or sinus infections. When you apply a nasal strip, the elastic bands inside the strip try to straighten out, pulling your nostrils apart and making your nasal passages wider. This action can reduce snoring and make it easier to breathe through your nose, which is great for a quieter and more restful night's sleep. However, sleep apnea is a more complex condition than just nasal congestion. It involves the muscles in your throat relaxing and blocking your airway, which can stop you from breathing properly during sleep. While nasal strips can help with nasal congestion and improve airflow through the nose, they don't address the underlying issues of sleep apnea. Studies have shown that nasal strips do not significantly reduce the frequency of apneic events or overall apnea-hypopnea index (AI) scores in individuals with obstructive sleep apnea (OSA). This means that even though you might feel like you're breathing better and snoring less, the actual number of times your breathing stops during sleep doesn't change much. For people with mild sleep apnea or those who experience snoring due to nasal congestion, nasal strips might offer some temporary relief. But for most people with sleep apnea, more comprehensive treatments like CPAP therapy are necessary to prevent airway obstruction. If you're using a CPAP machine and experience nasal congestion, you can still use nasal strips to help keep your nasal passages open. Just make sure the strips with the seal of your CPAP mask and test the adhesive to avoid skin irritation. In summary, while nasal strips can help with breathing and reduce snoring, they are not an effective standalone treatment for sleep apnea. If you suspect you have sleep apnea, it's crucial to consult with a healthcare provider to find the right treatment for your specific needs.